Hi, everyone. I'm Keith Kalmus. I'm the president of Nested Knowledge. So when clinicians make life-altering decisions, they rely on society guidelines, which rely on the medical literature. When the FDA or CE mark bodies want to know which devices and therapies to allow into the market, they rely on reports, which rely on medical literature. When insurance companies want to know what therapies to reimburse for, they rely on health technology assessments, which rely on the medical literature. When device companies and investors want to know what therapies to develop, they rely on market reports and the medical literature. Unfortunately, all this literature is communicated in the PDF, which is an extremely outdated mode of communication. It's non-interactive, it's non-updatable. This is what results, as I'm sure most of the PhDs in this room know. You end up mining data by hand. So there have been a lot of calls for this. The government, industry, and academia have all called for interactive and dynamic content, and that's what we do. We are a system of record for science, similar to what you'd have in finance in Bloomberg or Crunchbase. We're an enterprise research service, and finally, we're becoming a better journal. So our current partners, we have medical device companies as our clients, and we're relying on the institutional knowledge and heft of evidence-based practice centers. So there are 4 key steps in literature reviews and systematic review. First, our search automates inclusion and exclusion. Second, we use machine learning to automatically extract data from published literature. Third, we generate compelling data visualizations. And finally, all our data is automatically updated. So these are just some examples: clinical outcomes comparison, patient background correlation, and underlying patient population breakouts. My brother and I are serial entrepreneurs. This is our 3rd company. We started our first 4 years ago. I pitched at Walleye Tank earlier. Our second company, we got over $2.5 million in non-dilutive SBIR funding. We founded it with our 2 friends from college who are both developers. Thanks. And I'd love to take any questions.
Can you tell me what your business plan is and how you charge out for this service? Is it based upon a per report, or is it a subscription service, or how does it work?
Yeah, so currently, like I said, our only actual customers right now are device companies. It's about regulatory literature. So if I'm sure a lot of people in this room are aware, CE mark is coming online in May of next year. So there's a lot of demand for amalgamated and analyzed clinical outcomes literature. We have interested parties on the health technology assessment. And again, that's going to be like a custom, they send us the scope. We look at the volume of literature, give them a custom quote. Down the line, we're definitely open to a subscription model. We just don't have the massive data. An advisor of us basically said, no one's going to pay a subscription for a journal that's a page long. So we got to get more data in before we do that.
What's your end game? Do you have an exit strategy?
Yeah, for sure. We're definitely going to go for an acquisition. There's no one directly competing with us, but there are a lot of strategics that are trying to get into, Google, right? Google Scholar is a great example. They don't have amalgamated clinical outcomes data at the literature level. They're focusing on the patient level. So, an Elsevier, Wolters Kluwer, there are tons of giant strategics that are very acquisitive. UpToDate was acquired for $80 million. Definitely looking for acquisition.
You're basically using public data, right? So what barriers are there? Do you have IP or?
Yeah, we have a patent pending. And also, I think a lot of our defensibility comes from the fact that we've been building this for a year, and we had existing systems that we've been able to ape from our previous research company. So it's true that there's no. It's great for us that there's no limit to the access in the data we can get to. Unfortunately, that doesn't mean competitors can come in and get it. But if everyone starts doing data like this, I'll just be happy because it'll mean that we can collaborate. If everyone gets away from the PDF paradigm, we'll plug into their APIs, they'll plug into ours, and I just see them as potential collaborators.
So in the medical literature community, there's a lot of sort of good information. Information is not as great.
Right.
Center studies, things like that.
Right.
And I think some of the beauty of the data mining has to do with your ability to assess whether or not designs were put together well or not. How do you give that context to someone who's looking at this type of?
Exactly. That's a great point. So you can see on this slide, you can actually filter based on your preference. So we want to empower the user to be able to custom generate reports for themselves. So if you think that retrospective cohort studies are useless, filter them out. If you only want to see RCTs, just have RCTs. And then on the data collection side, like you mentioned, a lot of it has to do with relying on partnerships with existing institutions, which is why we're going after the sort of evidence-based practice centers. We're going to take their manual systems and automate them, and then improve upon them. So it's a great point. Empower the user to make their own decisions, and then automate existing quality systems and replace them with software.